Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about reviewing your fee schedule and reimbursements. This is something that should be done at least annually, and since we are in the third quarter of the year, I thought this would be a really good time to talk about this. Now, if you just opened your doors, I think it's fair to look at your reimbursements and your fee schedule at 6 months, just to make sure that you're billing high enough given all of your contracts that you have, because you kind of have to do a little bit of a guessing game when you start billing based on the contracts that you have when you start seeing patients. But then, like most practices, you continue to get more contracts in and become par status with more payers. And so that's a good time at 6 months, 9 months to really go in and make sure that you are getting paid what you should be and that you're billing high enough so that all of your payers are paying you their max allowables. Now, part of being a participation status and signing a contract with an insurance group is you are agreeing to accept their allowable fees. That's where that contractual write-off or that adjustment comes in. So if you bill out $150 for a service and one of your payers approves $90 for that and another insurance approves $80, then your adjustment is going to be that difference of $70 or $60. The thing that you need to make sure is that you do have a contractual adjustment on those EOBs, because if you don't show any kind of contractual adjustment, that means you're not billing high enough and you're not getting that max allowable. The hard part is that you don't want to be billing too high because you don't want your write-offs to be too much, but you also don't want to be billing too little where you're not getting all of the money you deserve. The other hard part is that you can only have one fee schedule for all payers. So if you're billing out Medicaid, which generally reimburses about 80% of what Medicare does, so it's your lowest, and let's say Blue Cross Blue Shield or Cigna is, 150% of Medicare, that's quite a difference, right? That's, 70 points difference. And so your write-offs from Medicaid are going to be a lot higher than your write-offs will be for Cigna or Blue Cross, which are your highest payers, but you have to find that happy medium. Unfortunately, it's not best practice and you can get in a lot of trouble if you have more than one fee schedule. So you really don't want to do that, and most places don't because of the repercussions that can happen. So you just have to make sure. So about 6 to 9 months in of a new practice is a good time to go in and evaluate your payments and allowables to your fee schedule. Now, if you're an up and running practice and you've been operating for, a year or longer, that year mark is really important to start doing that. And hopefully your system can run a report. I suggest to run it by payer, by CPT code allowables. So basically you would group and separate everything by your payers, and you would run your top, 20 CPT codes and find out what the allowables are for that, what you're getting reimbursed. Now, you can compare them to one another and see what the discrepancies are and which payers are lower for certain services and which ones pay higher to kind of give you an idea. A lot of insurances are a little bit more resistant to negotiating fee schedules like every year or two, but they might be more flexible at listening to you if you see one CPT code that's significantly less reimbursed than other competitors. And although you cannot share with them which insurances pay more or exactly what you're getting paid by another insurance, because that's a no-no, you can say you're coming in 15% less than average of all my other insurances, or you're coming in $20 less, so can we negotiate you reimbursing $10 more, or can you increase that a little bit? So without giving specific names of insurances and how much they're paying you, you can at least use it as a statistic and doing, hey, this is what we found, can you meet us halfway, what are you willing to do, can you help us out here, and maybe do it on individual CPT codes if they won't renegotiate the whole fee schedule. It is important though for you to kind of take a look and figure out what services you're offering, how much you're getting reimbursed, and how much it's costing you to offer that service. So maybe you offer a service that's not necessarily, required or something that you would have to do, but it's something you like to offer to your patients. But if you're seeing that insurances aren't reimbursing very well, you might have to go back to the table and be like, is it worth offering this service to our patients? How can we help offset the costs? I mean, we all know the cost of supplies goes up regularly. Your wages, any of your overheads, they increase. And so you need to look at the actual supplies used during a service you provide, how much it's costing you out of pocket. So you need to do kind of like an itemized cost of service for everything you offer, down to how many pieces of gauze you usually use in this, and how much it costs to sterilize instruments that you use, and how much staff time and how much that costs, and your time, the provider's time, and how much it costs, and really do a breakdown to see how you're making money. This is time consuming, but if you kind of do it in the beginning and early on in your practice and figure out how much it costs you to offer your specific big, services that you offer often, the toenail removals, the wart removals, nebulizer treatments, vaccines, all of that kind of stuff, taking into consideration every little piece of supply, time, everything, and figure out how much it costs you, then see how much you're getting reimbursed from the insurance company. That will help you a lot in your negotiations as well. So for instance, United Healthcare reimburses tetanus terribly in my experience, and it's honestly less than what we paid for one dose of Tdap in the office from our wholesale supplier. And I went to United Healthcare and I said, look, like your reimbursement is lower than what we're paying just for the vaccine. That doesn't include my staff time, the supplies, or anything, and they weren't willing to negotiate. So we made a decision as a business to start having patients have to go to the pharmacy to get those vaccines, because it wasn't beneficial for us to be able to give that, because we would lose money. And as a private starting practice, that's really unreasonable. But you have to pay attention to that kind of stuff. And sometimes you have to make the less favorable decisions, the less popular decisions. But this is what's going to help you. So it's time to really start diving in, looking at that now that the summer's winding down. Run those reports, look at what each insurance is paying for your big CPT codes that you bill out often, top 20 maybe, and looking at the allowables and what they're being paid to you, and then what your costs are for those services. And then you need to sit down with the other providers, managers, billing, whomever would be involved, and talk out what needs to be done, whether it's going to the payer and negotiating increased fees, the whole fee schedule, individual CPT fees, or if it's not even worth offering a service anymore, or if patients are going to have to start paying for it out of pocket and making it all self-pay service instead of sending it to the insurance. There's different ways you can be creative, but you have to have these conversations and these insights in order to watch your bottom line as a small private practice. If you have any experience doing this yourself in your practice and you have some tips that you'd like to provide to your colleagues and people watching this video, please leave that in the comments below. If you have any suggestions, comments, or questions on the topic, also leave that in the comments. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already. Thank you so much, you guys, for the support. I really appreciate it. Take care of yourselves. Bye-bye.